And you're right. It's such a shame the way that the hospitals approach birth. It is not a, for the most part, it is not an emergency situation. If you're a healthy woman with a healthy pregnancy, it's a beautiful, wonderful, natural, physiological situation. God equips your body, even if you've never given birth before, to know what to do. And it's really quite beautiful. And many women have given birth for hundreds and hundreds of years perfectly fine, at home. It's when we start to have all of these different interventions put in. Yes, am I glad that we have a system that can, in emergency situations, step in and help mothers that are hemorrhaging or different various emergencies that can happen during birth? 100%. But why is it that America has one of the highest infant and maternal mortality rates amongst developing countries? Why is it that we have the highest C-section rate? And the list goes on and on. It's because of all of the steps and the interventions that take place and the unnecessary surgeries and C-sections that happen because of the training that the doctors undergo, because OBGYNs are surgeons at heart. And a C-section is a surgery, because of schedules and the fact that we've all told ourselves, for whatever reason, that women have to have an epidural, women have to have Pitocin and all these various things to have their birth go according to hospital's plan. And myself having 2 natural births, I can tell you that you can give birth without an epidural. You can give birth naturally, letting the child, initiate the labor on their own. And guess what? Most times that makes the labor go better, because you're letting it happen naturally, and your body do what it is naturally built to do, rather than forcing yourself to have the baby before it's ready. Of course, then we're going to have other things step in, and the doctors do other procedures and have other interventions, and they all just kind of snowball. And so there's a time and a place for every sort of medical care, including in pregnancy, but it is very much overused here in the United States. And, I think that it's a shame that women have been told that they can't give birth on their own, that they have to have the hospital, they have to have drugs to do so. And I'm telling you, your recovery is better when you don't have to detox from the drugs, as well as recover from the birth itself. The birth is just so much more magical and beautiful, and the time right afterward is so much more magical and beautiful. If you are able to do so with a healthy birth, I encourage women to, at the very least, attempt a natural birth without the drugs if you do want to give birth in the hospital. But a home birth is such a beautiful scenario. We need to reframe our mind on birth and medical care, and know that we empower ourselves, know that we have that instinct within ourselves to navigate our own healthcare choices, rather than just defaulting to whatever the physician says to you without asking questions and without seeking alternative methods. Knowing that God has given you that instinct as a mom, as a parent, as a person. You know your body better than anybody else. And so but it's kind of all a part of that mental game, right? They don't want you to feel empowered. They don't want you to know that you can do these things on your own, because if you can heal yourself on your own, if you can give birth on your own, if you can do these things on your own, what else can you do on your own apart from the government? They want you to rely on them. And our healthcare system is very much intertwined and intermarried with the government.